Ready to start? Okay. Ladies and gentlemen, it's been some years since Dr. Ricardo James spoke. I forget the year, but I remember you were here. Graduated from the University Guadalajara, the Autónoma, which I always like to point out that that particular university probably trains more physicians for the United States than all the medical schools in the United States put together. And it obviously is a good institution. Dr. James was a conventional doctor for a while, worked with Ray Evers. Some of you may remember Dr. Ray Evers, and he also worked with Dr. Harold Manor at the Manor Clinic. And now he's operating the Good Samaritan Clinic in Juarez, and we're very happy to have you back.
It's always nice to be here. Thanks a lot. Thanks a lot. Thank you. Thank you. Thank you. Like Mr. Frank say, my name is Ricardo James. I'm a MD, and I was here about 20 years ago. That was the last time I came here, and it's nice to see people like him, like Lorraine. She's marvelous. She's something else, and it's a pleasure to be here today. I really appreciate that for them, and thanks to you to be here. Well, what I do is I got a hospital named the Good Samaritan Medical Center, and well, he mentioned two names, Dr. Ray Evers. They used to call him the grandfather of the chelation therapy, and well, I spent 6 years working with him, and then he died. And before that, I worked with Dr. Harold Manor in Tijuana, which I spent 7 years of my life. Beautiful. I love California, and I learned a lot in Tijuana. And I went by my own 20 years ago, and I opened my own place. So what I do is, well, to take care of my patient in the best way. I believe in integral, putting all together the good things for the benefits of the patient. One of the main group of people who come to my patients, there are people who are dealing with cancer, breast cancer, lung cancer, prostate cancer, colon cancer, and some other different type of real bad cancers. And but cancer is not a life-death sentence. I got quite a few patients who become my friends, and they are alive, and they are doing just great. So when you approach the cancer patients, you need to treat the cancer, but also it's most important, you need to treat the patient. So when a patient comes to my hospital, the first thing I do is listen. Listen to the patient, because it's very important to listen to the patient. Patients come from Canada, from East Coast, mostly, Amish patients or Mennonites, from California too, and most of them, they are tired, they are looking for help here in the United States, which is, because in the United States, and I don't come to criticize anybody, but in the United States, Dr. Evers used to say that there is not a health department, that there is a sick department, because people need to be sick, because there's a lot of money involved, and you know better. Anyway, he used to say that, and I believe in that. America is very good, United States is very good for emergency, for any type of emergency, you got it. It's the best medicine you can practice. But to talk about prevention and to talk about freedom of choice of treatment, well, they are way behind. Health-wise, the United States is not doing well. That's the reason people go to my place, and well, whoever comes to a place is not a number. It's a patient, and well, I treat the patient. He's the boss. I always tell my patients, you are the boss. I give you the options. You ask me, the way I treat one patient is I try to put my body in the shoes of that patient, and then you can make a better decision how to treat this patient. You know, because chemotherapy, radiotherapy is good, but not too good. Not too good, really. Like people with leukemia, well, at these days you can use small amounts of chemo, but always combined with natural things, natural therapies. You know, one of my main therapies that I use is chelation, which is high dosage of vitamin C, but also for cancer patients. That chelation is mostly for patients with cardiovascular disease, which, by the way, is the leading cause of death in the United States. The second cause of death in the United States